So this is a little brief overview of what we're going to do today. I'm going to introduce y'all to my office, Southern Stem Cell Institute. Then we're going to talk about pain in our healthcare system. We're going to talk about regenerative medicine and something called allografts. I'll explain what those are and the science behind all this. Answer some common questions and then tell y'all a bit different about what's special about our office. And then most importantly, we're going to be, if y'all would like to see us, there's an opportunity today to book an appointment. Bianca, the lady that you met when y'all first came in, she works for me and she can get y'all an appointment. And normally it can take sometimes a month or two to see me. I stay very busy. I do talks all around Georgia and around the Southeast and around the country sometimes. And so I stay very busy, and my schedule, it sometimes takes a long time to see me, but I try to open up spaces in my schedule. And I'm a workaholic, so I tend to work on the weekends, even late nights. So I know this Saturday I'm even opened up some space if some of y'all want to come see us this Saturday or early next week. Because I know it's hard sometimes, especially if you've been suffering and you're having pain and you're tired of dealing with it. I don't want you to wait another day. We want to see what we can do to help y'all. And when I founded my offices, we came up with a mission statement. And basically this is what everybody in my office adheres to, what I want everybody to look for and how to treat our patients. And our office, we're committed to research, and we do state-of-the-art stem cell and regenerative medicine therapies, but we do it in an ethical and safe manner. And what's important about that is we're not here to try to take your money, we're here to help you. And I became a doctor to heal people, to help people, and I love what I do. There's no better feeling in the world than making somebody feel better if they've been suffering with pain, if they've been having health issues where nobody else has been able to help them. And with these treatments, we're able to do that. And we do them in a safe manner as well. Everything we do is extremely safe. It's safer than any other surgery or treatment or medicines I've ever prescribed to people. This is just an incredible treatments that we do, and we'll talk all about them today. And we have two offices here in Georgia. We have one in Buckhead, about 45 minutes away, and we have one in South Georgia in Valdosta, right near Florida. So if you have some family or friends down in Florida, we see a lot of folks from there to come up to see us. And obviously Atlanta's not too far from y'all. And this is what our Atlanta office looks like. We share space with this office, Southern Vein and Laser Center. And then this is our Valdosta office. So a little bit about myself. So I'm a founder of Southern Stem Cell Institute. I'm a medical doctor. I did my initial training up in Canada, but I've done training in South Florida, all across the country and around the world with specialists in regenerative medicine, anti-aging stem cells. I myself am a stem cell patient. That's why I'm so passionate about what I talk about and why I do these talks. About 4 years ago, I had something called plantar fasciitis. Has anybody here had that before? Yeah. How did it feel? It hurt. And not too good, right? Yeah, and I had one of the worst cases I've heard of. I had it for a whole year. And it started out just as a dull ache in this left foot, and it slowly got worse and worse and worse. I saw all my specialist friends. They gave me pills, shots. They even gave me a special shoe to wear. That didn't help, and the pain got so bad it felt like a knife. Every time I took a step, it felt like I was stepping on a knife or a needle. And after a while, I started limping because I didn't want to put any weight on my left foot. I put all my weight on my right, and then my back and my hips started hurting, my neck, and it just got worse and worse. And finally, they said, well, you need to have surgery on your foot. And I looked at the procedure and looked how successful it was, and it wasn't very good. It was 20% or less success rate, and it could cause permanent nerve damage. I said, no, I don't want to do that. So I went ahead and got a treatment with the regenerative medicine therapies we do. About 2 to 4 weeks later, my pain was completely gone, and I haven't had a single pain since then, and that's 4 years ago. So it changed my life. I was miserable. I was getting depressed. I was tired of hurting every day. I'd wake up in the morning and I'd think, oh my God, I'm gonna walk all day, I'm gonna be in pain, this sucks, I don't wanna go to work, I don't wanna do anything, I just wanna lay in bed. And I know all of y'all that if having pain can relate to that. Pain is awful, and I know people live with it for years, and it's just terrible when I hear these stories of folks suffering and having pain. And so that's why I'm very passionate about this, and why I'd love to help anybody and everyone here who's having health problems like that or knows a loved one like that. I'm very fortunate to have worked with all kind of celebrities, athletes, world leaders here in Atlanta and around the country, but I'm here in Newnham because I want to talk to everybody. I want this to be a treatment for not just rich, healthy, famous people, but anyone, for anybody, anywhere. I'm a member of all these kind of societies and many more. And then I actually have a radio show here in Atlanta on 95.5 WSB. It's early on Sunday morning at 6:30, but if I get a lot of patients that hear me because they can't sleep. They've been up all night in pain and suffering. So, but if you're ever up that morning, you can listen to us. But if you don't want to get up that early, we have some old episodes on our website here, www.ssci.life. And those folders that we handed out to y'all, they've got a lot of information. They've got our website listed there, and they talk about some of the other therapies and the things we're going to talk about today. This gentleman here is Dr. Neil Riordan. I was with him here in Dallas at his office there, and he's one of the pioneers, one of the probably one of the founding fathers of this whole field, regenerative medicine. He and his family have done work in this area for many years, 20 some plus years, and he's published over 70 different articles on stem cells. He's got about 40 different patents in this field. He even has a few books that he's written, and we're very blessed to work with him now. He came out with a product this year that we're one of the first offices to use, and it's about 5 times more powerful than we've used before. And all these testimonials, most of them are from patients in the past, so you can only imagine everything we're doing now is about 5 times better. And I'm proud because, again, being a leader in this field, I travel all the time. I go to meetings and conferences and talk to other doctors around the world that deal with stem cells, and I'm always trying to bring the best of the best to my patients. And fortunately, we've been able to work with Dr. Riordan and use his product now. And this is him again. This is how you spell his name, Neil Riordan. And again, he has, like I said, over 70 articles. And I'm very fortunate to work with these ladies. This is Shamika in South Georgia, and then this is Elena in Atlanta. Both of these women are top of their class, and they're very passionate about taking care of patients as I am. They really care about what they do, and we all love what we're doing with regenerative medicine. There's nothing more powerful and more safe than what we're doing in our office, and so we're very blessed to work in this field and work together. And I want to show you just, these are a few of the people I take care of. This is TYRESE GIBSON. Y'all may recognize him. He's been in all these Fast and Furious movies. He's a world famous singer. He came to see me because he was having some neck and other pain issues. And he was in a lot of pain. He was miserable as well, and we treated him. And now he's working all the time, and he's smiling like this every day. I take care of a lot of professional basketball, baseball, football players, all from all sports. This is one of my patients, Ryan Schrader. He used to play for the Falcons with us, but he had a neck and back injury many years ago from college that got really bad. And he was told he needed surgery, and he didn't want to go through that. So we treated him with just one shot to his neck and his back, and that cured his pain. And he played well for many years after that. This is J.D. Drew. He's a retired baseball player. He was an all-star for the Boston Red Sox, and he had a bad back injury that made him retire that we treated, and now he's pain-free from that. And this is one of my favorite patients, SONNY SHROYER. I don't know if y'all ever watched that show, Dukes of Hazzard, but that used to be one of my favorite shows growing up. And he played the Deputy Enos, but he and his son came to see me. They were both having some pain issues that nobody was able to help, and now they're both pain-free and doing well. And finally, this is the lady, Belinda Skelton. Well, there she is. And she has her own radio show here in Atlanta on WSB Radio every Saturday afternoon called Atlanta Living. But she'd been in pain for about 14 years with lupus, and she'd seen several different doctors. Nobody was able to get her pain-free. And finally, we were able to treat her, and now she's sleeping every night, and her pain's completely gone. So what causes pain? What is pain? So you can have 2 types of pain. You can have acute pain if you fall down and hurt yourself. If you're an athlete, you may have pull a groin or a tendon or have an injury that way if you get hit. And then you can have chronic pain. This is pain that develops over many months and years from arthritis and other health conditions. And both types of pain are related in that they both have inflammation. Inflammation is swelling, redness, soreness. And that typically is the first thing that happens when you have an injury. And then over time, you can have changes in the actual tissue like you see with arthritis. But obviously, pain is terrible. And I was talking about how pain affected me. And I know, is anybody else here suffering from pain? Stupid question, right? You guys wouldn't be here if you weren't. But yeah, pain's miserable. It's awful. And it can affect every aspect of your life. It can affect your income. You know, when I was having terrible pain in this foot and I couldn't work or work in the operating room, I was out. Couldn't make a penny. Here, when I was, quality of life, just going for walks or spending time with a loved one, you can't do that when you're in pain. And even in fun activities, golfing, gardening, simple things you can't do. And even little, like I mentioned, simple things like going to the restroom or going to the kitchen when you're in pain, that can be a chore. And you take these things for granted. And unfortunately, this is kind of what happens with our current healthcare system. If you get sick, you go see your doctor if you're having pain or whatever problem. Very first thing they want to give you is some kind of prescription pill. And you try that for a while and it doesn't work, and you go back and they may give you another one and another one. And when the pills don't work, then the surgery is usually the next option. And sometimes folks have one, two, many surgeries. And unfortunately, I see a lot of folks that end up seeing these doctors, pain doctors. And all the pain management doctors usually can offer you are more pills, more shots, things, epidurals, which are steroid shots, and that's it. It's very rare that somebody who sees the pain doctor gets cured and doesn't have to take any more pain pills or shots. But things are changing now, fortunately, to this new field of regenerative medicine, and part of this is stem cells, and so we're going to talk about them and how this all fits together.
Stem cells are cells that are undifferentiated, meaning they do not have a specific job or function. While skin cells protect your body, muscle cells contract, and nerve cells send signals, stem cells do not have any specific structures or functions. Stem cells do have the potential to become all other kinds of cells in your body.
So probably the easiest, simplest way to think of stem cells in this field of regenerative medicine, this is our natural, normal way of healing ourselves. If you get a cut, say in your hand, your body realizes, hey, there's something wrong, and sends stem cells and other types of cells to that area, growth factors, other things. And the first thing they do is they tackle inflammation. That's the first thing we talked about that is related to pain. So they'll help with swelling, redness, soreness. And then once they treat that, they'll actually start healing the tissue that's damaged. So if you've got a cut, they'll help heal the skin cells, they'll heal muscle, nerve, tendon, bone, whatever's damaged, they'll start healing those cells and regenerating them. And that's how our body naturally heals itself. But with the treatments we do, it's the same thing, same principles, same things happen. And it's just amazing how safe and how powerful these treatments have become. And there's a lot of history. We've known about these for a while. Not sure why it's jumping ahead so much. There we go. This is a little timeline of stem cells here. Back in 1868, that's when there first was a German biologist who coined the term stem cells. And ever since then, we've been doing all kinds of research on this field. The early 1900s, the Russians did a lot of work. And back in around the early 2000s, if those of y'all remember that time, there was controversy about stem cells. And when George W. Bush was our president, he passed a law banning the use of what we call embryonic stem cells. Those were stem cells that came from aborted baby fetal tissue. And so ever since then, nobody in our country has ever worked with those, and I'm Christian, I don't believe in those and never have worked with those. But despite that, we've had a lot of big, huge breakthroughs the last 20 years in healthcare and how we work with stem cells in regenerative medicine. So where did they come from? Well, we talked about the embryonic ones that we don't use in our country anymore. So there's really two sources, autologous, which means comes from your own body, and heterologous, which comes from somewhere else. Autologous, these sounded like a great idea, and this technology has been around for 30, 40 years. And what we would do is there's two areas in the body where there seems to be more stem cells than others. There's bone marrow, which is usually the hip, or fat, which we see came from the flanks. And the problem with these treatments is they were only about 20 to 40% effective, and that's not a great success rate. And the reason for that is, number one is we had very few cells to work with, maybe 5,000, 10,000 or more at the most, which sounds like a lot, but our bodies have billions of cells, so that's not very many when you think about it. The other problem is the older we get, these cells just don't heal like they did when we were little kids, when we were young. So we had fewer cells, and the ones we had weren't very good. So that was the problem, and continues to be the problem with these procedures that are still done today, even in Atlanta here. What's changed the game is the last 10 years, we've started working with these cells, heterologous stem cells. And back when I was in medical school 20 years ago, we used to deliver babies and we'd cut the cord and we'd throw this tissue away, the cords and the placentas. We thought they were medical waste, garbage. But what we discovered is there's actually millions of healthy stem cells and growth factors, all kind of things that are in these tissues. And they're the most powerful and the most amazing safe treatment that I've ever seen in tissues that we've ever worked with. And there's two types. The type we use are called the Wharton's jelly, and I'll explain that here in a second. So Wharton's jelly, it's what surrounds the blood vessels in an umbilical cord. So there's no blood in this product at all, but it contains growth factors, cytokines, hyaluronic acid, and millions of the stem cells, mesenchymal stem cells. What's great about the umbilical cord too, it's like a neutral zone. It's really not associated with the mom or the baby, and there's no negative biologic markers, so anybody can get these. It doesn't matter if you're black, white, short, or tall. If we give you these cells, they're gonna work on you and they're gonna heal you. And all this is supervised and regulated by the FDA, and the lab we use is tremendous, like I said with Dr. Wharton. And this is what the Wharton's jelly looks like. So it's this stuff here that surrounds these blood vessels in the cord. Just to give you an idea, if you may hear this term, allograft, and what that means, it's basically tissue that comes from that Wharton's jelly and it's put into a little vial. And that contains not just stem cells, but contains hyaluronic acid, it contains growth factors, things called cytokines, things called exosomes, all these things go in there, into these little vials here. And that's what we get from the lab, and then we keep them frozen in a tank, and we can use them for many years, but we usually use them within a few days of getting them from our lab. Now, when y'all think back to when you were really young, 2, 3, 4 years old, if you got cut or hurt yourself, how long would it take y'all to heal? Anybody remember way back then? 2 days is the average, 48 hours. And the reason for that is it was so fast and so healthy is we had millions of stem cells. When we're young, 1 in every 10,000 cells in our body is a stem cell. But already by the time we're teenagers, we have 1/10 that number. And age 30 is kind of a bad age. That's when we don't have enough of these cells to keep us young anymore. So the older we get now, we just start wrinkling, we start having losing our hair, starting to get blood pressure, cholesterol, arthritis, all these other chronic disease and health problems start sprouting up around that age. And it gets worse over time as we get older. And unfortunately, if you get cut and you're 50, 60, 70 years old, it might take you a week, not 2 days to heal or longer. And you might have infection, you might have scars, all these other complications, again, because you just don't have this healing power that you did when you were young. What can we treat with these cells? Well, basically any orthopedic condition you can think of. So cartilage, meniscus tears, ligament tears, something called bursitis, rotator cuff damage, knee, hip, spine, shoulder, elbow, ankle, hand, foot, any of these joints from head to toe that you're having pain or problems with, we can help. And we can even help nerve damage now. Does anybody here have something called neuropathy? Okay, we're going to talk all about that in just a little bit, but this is really the only treatment I've ever found as a physician that can actually help and even make neuropathy go away. So radiculopathy, the other name for that is sciatica. So if you know anybody who's got pain in the back that goes down the legs, we treat that all the time. Bulging herniated discs, we treat those. And even it's showing that stem cells can even help, and regenerative medicine can help erectile dysfunction in men. Osteoarthritis, that's something we treat every day in our offices, and we treat joint disc disease, things called stenosis, even minor little fractures we can heal and speed the healing with these treatments. And what happens with our system is you come to one of our offices, you see one of us here, and then we spend a whole hour or more with you doing a consultation exam and discover what's wrong with you, what's been going on. If you've got bad knees, we'll look at old x-rays and look at you with our ultrasound. Whatever your problem is, a hip, back, neck, you name it. And it's just incredible what we can find out just sitting down and talking to people. That's one thing that's been lost over the years with doctors is they have so little time to spend with people. You're lucky to spend 5 or 10 minutes with a doctor nowadays. But we try to spend all the time we need with you and find out everything that's going on, because we want to help you not just as a body part, not just as a knee or a hip, but as a whole person and make you healthier and let you live a better life. And again, if everything looks good, we can treat you that very same day with these allografts that are amazing. life-changing. And what's great about our treatments is, again, there's really minimal to no side effects. It's this, not only the most powerful treatment I've ever seen as a doctor, but the safest. I've done thousands of these treatments, and I've not seen one person have so much as a rash from them. The only complaint I hear is sometimes people feel tired for 2 or 3 days after a treatment. And the reason for that, I think, is because our bodies are telling us you need to rest. When you rest, that's when our bodies actually start healing themselves. So that's really the only complaint. And after that first few days, people say they have more energy than they've had in years. No drugs or operations are involved with any of this. And this actually, the treatments we do actually heal the condition that's wrong. It's not a Band-Aid, it actually helps heal the problem. Typically only one treatment is needed, one injection, and that's amazing too. It's not like you have to come back every 3, 6 months or a year like you do for steroid shots. This is a one-time treatment that can last you for many years. And again, we have all kind of amazing technology in our office as well. I've tried to bring the best of the best around the world into my office to help our patients heal and to get better quicker as well. What I'm going to show you all now is what normal and abnormal tissue looks like, how we used to treat it, and now how we can treat it with these regenerative medicine treatments. This is a knee here, and you can see the bones very clearly. This is a plain x-ray of the knee. And there's a space in between, which is a joint space full of fluid and cartilage. Over here, this is what we call bone-on-bone arthritis, where the bones are rubbing on each other. The space looks like it's almost gone. Here's a normal-looking hip where you see the femur and the hip bones clearly. Here's somebody with bad arthritis in the hip with all this arthritis there, this white stuff. And when you have those kind of problems, you're obviously in a lot of pain. And when you go see your regular doctor or orthopedic doctor, this is all they want to do for you. Start off by giving you pills, and there's 2 types. There's the opioids and the NSAIDs for pain pills. And they both have serious problems. The opioids, the problem with them is they work at the beginning, but then you need more and more and more of them to get you pain relief. And the problem is after a while they become addicting. You get used to them. You need more and more and more of these pills to get any kind of pain relief. And a lot of people have serious problems with these pills. They can stop your breathing. They can even stop your heart and kill you. So every day in our country, you'll read about people that die from taking too many of those pills. These other pills, the NSAIDs, the over-the-counter versions are Advil, ibuprofen, Motrin, Goody powders, and there's a whole group of prescription ones. And they have damage. They cause problems as well. They can cause bleeding in your stomach. They can cause ulcers. They can cause kidney failure, kidney damage. So they're dangerous as well. They're not something we want you to take for very long. And when these pills don't work, the next thing doctors want to go to are shots. Has anybody here had a steroid shot before? Almost everybody, okay. I haven't given one of those shots for 10 years. You know why I stay away from giving people steroid shots? Well, they don't work very well, but the #1 reason is that they're really actually bad for you. The steroid shots actually break down tissue in our body. So there's 2 types. There's the anabolic steroids, that's what the bodybuilders used to take to build muscle. The ones you get from the shots from your doctor and the pills, those are called catabolic, and they break down tissue. So they cause bones to get brittle and weak and break. They can cause muscle to tear, ligaments, cartilage to tear. And what's worse is they get in your body. When they get a shot in your arm or your back or anywhere, that doesn't just stay there. They go everywhere. And so they cause, if you have diabetes, they'll make your sugars go out of control, and they can even cause diabetes. I've seen people get diabetes from these shots. So that's why I don't give these shots anymore. These other shots here, Supartz, Rooster Comb, Synvisc, these are just a Band-Aid, and they may make you feel better for 2 or 3 months, but then you start hurting again. And finally, when the shots don't work, surgery is usually the next option. And even if surgery does well, you may be in rehab for up to 2 years, just recovering from the surgery, even when it goes perfectly fine. So what if for years, doctors like myself would try to figure out what's better, surgery or stem cells? And looking at several different articles about both of them and comparing the two, there's really no comparison if you look closely. The cost alone for surgery is crazy, up to $110,000 to do a knee replacement, one single knee replacement. And it's sad is even if you've got good insurance, it can be really expensive. I had a guy come see me, and he had knee surgery, recent knee replacement. It cost $110,000 here in Atlanta. He thought he had good insurance, but he still ended up owing the doctor in the hospital $30,000 after everything was paid for. That's crazy. And the sad thing was he was still hurting, and that's why he came to see me, to see if we could help him, and now he is pain-free. Our treatments run anywhere from $5,000 to $6,000 to treat one knee. Complications from surgery can be very, very deadly, actually, very bad. A couple people in every group of studies that I've seen have actually died from knee surgery. A couple have blood clots in the lung, a couple have heart attacks, and a big group of people have infections that can be where they have to go back in the hospital and get antibiotics. In all the studies I've seen, not a single person's had a bad complication, and like I said, the worst thing I've ever seen is a rash. The important thing about the surgery and comparing it to the allografts or the regenerative medicine treatments is successful. How successful are these treatments? And if you talk to people that have had surgery, some do great. That's about 50% of the time. They'll say, yeah, I had my knee replaced, I'm doing fine, my shoulder done. But the other 50% of people aren't very happy, and some have had really serious complications. Out of the group that got regenerative medicine treatments, the studies show that 90% of people do really well, and that's fantastic. And again, the risks are minimal to none, and they're very powerful. You don't have any downtime, any problems like you can have, no serious complications. And what's also great is these used to be just treatments for the very rich and famous. You'd hear about people going to Europe or to South America or Asia to get treatments done. Sometimes they'd spend a fortune. The minimum they would spend would be like $25,000, sometimes a couple $100,000 to get these treatments. In our office, our treatments average from anywhere from $5,000 to $9,000 or $10,000 for the allografts. So that's a lot less expensive, and we always try to work with people and see what we can do with their budgets as well. So welcome back. Tell me about your how you felt before you came to see us.
Well, before I came to see you, I was walking on a stick and a walker. I couldn't bend down. I was having a lot of difficulty moving, and I was getting worse and worse. And I refused to have back surgery because everybody I talked to was not happy with the results. So this was a great shot. We had experimented around talking to a lot of other people, and your program sounded the best.
Okay, wonderful.
So
tell me what you weren't able to do a few months ago that you can do now.
I couldn't bend down. I couldn't walk fast. I had to hold on every time I'd get up and down. I had to use, when I go out, I'd have to walk with a cane. I couldn't turn fast. I was just having great many issues with movement. I was in constant pain.
And when did you start noticing a big change?
Well, after about 3 months, I started to notice that the numbness from my hips down seemed to be moving down, and now it's just down to my toes.
Okay, great.
And I got feeling in those. It's not normal, but it's a whole lot better.
Yeah. And you had your back pain. What was it before and what's it now? Like it was like a 10 before?
Yeah, it was a 10 before, and now I'm down between a 0 and a 1.
Wow, fantastic. And so what kind of things can you do now you weren't able to do before?
I can do everything now that I used to do 20 years ago. There's nothing I can't do that I haven't found anything I can't do. Well,
Playing sports,
I walk, I do exercise. I used to ride a bike. We haven't repaired our bikes, but there's nothing I feel I can't do. I'm thinking about trying to go bowling again.
Oh wow, fantastic.
And see how that does.
Yeah.
But I feel like I'm up to it now.
Fantastic.
I feel like up to everything, I'll be 76 shortly, and I feel like I'm 50.
That's awesome.
No problems there.
Mr. Murray, can you show me how well you could move before your treatment? What kind of limitations you had?
I could bend down this far. I could turn like this. And when I'd walk, I'd have to walk
You had a cane to walk.
with a cane or a walker. It was very difficult getting in and out of a car. It was just becoming a real issue for me.
And this was a whole year you'd been with this?
For a whole year, and it was just getting worse and worse.
Wow. So show us how you can move now. Can you bend down now?
All right, now I can get down, wipe the floor. I can jump up and down.
Wow.
Turn.
That's amazing.
I can
Okay.
sit down and jump up. getting in and out of the car.
You don't need a cane anymore.
No more cane.
No, that's
Oh,
amazing.
So I'm doing great.
That's fantastic.
And then, you know, you said it'll get better and better up for 9 months. So
you're doing
hey,
fantastic.
there's nothing I won't be able to do.
So that was 6 months after his treatment. This is a year. And he was using a walker and a cane. Hey, Mr. Kurtzberg, welcome back again. Tell us now, how long has it been since your treatment? Last time we saw you, you were about the 6-month mark. Where are you at now?
A year and a week.
Okay, great. And how are you feeling now?
Feeling great.
Good.
Couldn't ask to be better.
And have you noticed more improvements since when you were here at 6 months?
Yes, I have. A lot of improvement.
What's changed now?
I don't hurt. I don't limp. My hair started to grow back up here. I just feel great all over.
Wow, that's fantastic.
I feel like I'm 50 years old again.
Awesome, awesome. That's great. And I know when you first came in, you were using a cane and a walker. Now, how's your movement now?
Great. I feel like I'm 40 years old.
Okay. Well, we're going to show a little video of how well you move so people can see how you're doing. So I want him to be my personal trainer, but we're that's
one treatment he had.
One treatment. Yeah, great questions. Well, we'll keep going, and then I'll answer some more questions you guys have. So what can we the allografts do? So this is what damaged cartilage looks like. So if you have a torn cartilage in your knee or your hip or shoulder somewhere, it looks like a broken egg. You see all these cracks everywhere. And the only thing as a surgeon I'm able to do is take a pair of scissors and clip this little bit of tissue that's sticking out right here. So if your pain's coming from these, from these cracks, it's going to continue to bother you after the surgery. And eventually you'll get arthritis and other problems with that knee or that tissue. But this person got just a one-time shot of regenerative medicine allograft, and 12 weeks later you can see the difference between the two pictures. This is like a broken egg and this is a whole normal-looking egg. Nothing else can do that. No pills from the hospital, the pharmacy, or no shots or no surgery can do this. Just these regenerative medicine allografts. This is an MRI of the knee, and it shows the same type of thing. This is somebody with damaged cartilage and tissue inside the knee. They got one shot of allograft, and 5 months later, you can see all this damage is cleared up. And this is cartilage right here, and it's grown 75%. And that just is part of the healing process that we see with these treatments. And unfortunately, very few doctors know about this or familiar with these treatments. I'm trying right now, I'm involved with a group of other people trying to educate doctors so you'll maybe hopefully start seeing more of these treatments, but that's what they can actually do, and people aren't aware of that. Let's talk about back pain. I know that's a pretty common complaint. This picture right here, this shows a normal looking spine. At the top you can see these are called vertebral bodies, these little squares here, and in between there's a disc. But what can happen over time, the disc can break down so it can bulge or herniates where it pinches nerves. And then the bones can start breaking down, getting arthritis. And this is called an osteophyte, or the other name for that's a bone spur. And when you have those problems and you see a back doctor, this is what they want to do to you. They want to put these screws in your back, these rods, or they want to rip everything out back there. Now the problem with these kind of surgeries is 40% of people, 40, are worse after these surgeries than they are before. 40, can you imagine? And that's why I've never wanted to be a back doctor. I wouldn't want to make one person worse, never mind 40% of people I worked on. But this happens every day in our hospitals around Georgia and around the country. It's terrible.
If they have what's in their back, can you give them the allograft and it will help?
It will help these people, even if you've got metal in your back. It won't, they can't do anything with the metal, but what happens is this tissue right around the metal, it gets irritated and inflamed. And the allografts can go in there and cushion that area and give you pain relief where nothing else can. So I see a lot of folks that have seen many pain doctors or on pain pills and shots and nothing helps, and we treat them and they actually start getting some relief where nobody else is able to help them.
Can speaking for that specifically,
Yeah.
do you have experience with people who have had that?
Oh yeah, all the time.
Significant?
All the time. We've had people have 4 or 5 back surgeries that come and see us. And we finally are able to get them some relief. Yeah.
What kind of relief?
Where maybe their pain will be cut at least in half or more. Yeah. Yeah. And to someone who's been in pain every day, that's a miracle in itself, just being able to cut that in half. We can't do anything with the metal, obviously, but it's amazing how much better you can feel with the treatment versus anything else than a pill or shot or surgery again. Yeah.
Thank you.
Yeah, no, welcome. Let's talk about neuropathy. I know a few of y'all have that. What happens with neuropathy is you get nerve damage, and when you get to about 50%, you can start having pain, but you can have all these problems: loss of feeling, imbalance, temperature control. You can even get burning and freezing sensations, pins and needles, even shocks. And what's really bad, when you get to 90% nerve loss in your foot or your hands, you lose the feeling. So you can be walking on a carpet like this and not even know you got a cut. And what's really bad is you're really prone to getting something called foot ulcers. And foot ulcers are terrible infections. They can spread through your whole body. People die from those. So the only way we used to treat people that had these was to cut your foot or your leg off. That's the only option we had. Is anybody here taking these pills? Gabapentin, Neurontin, Lyrica, Cymbalta? Okay. I know a few of y'all do. Do y'all know what these are? These pills weren't made for neuropathy. They weren't made for pain or depression. You know what they were made for?
No, my doctor just told me they were for nerve pain. He just doubled.
Yeah. They use them for nerve pain, but these were actually made for seizures. These are seizure pills.
Oh, yeah.
Yeah, so when you had a seizure, you'd shake all over. It's because you had an electrical abnormality going on here in the brain. And all these drugs do is block that electrical activity. And some of the side effects from these drugs are drowsiness, dizziness, and that's because that's what they do, is they affect your brain, your thinking. But what happens with neuropathy is the damage is way down here. It happens in your hands and feet and these small diameter nerves. And these are nerves that don't have myelin, so they can be attacked by sugar from diabetes. They can be chemotherapy drugs can cause damage. There's about 100 or even thousands of different causes. And a lot of times we don't know what that is. We call that idiopathic neuropathy. But no matter what the cause, it kills the blood supply to the nerve. And when that happens, it sends a signal to the brain. And all these drugs do is block that signal. They just make you forget about it. They don't heal this damage. This keeps going on and on and on and on. But with regenerative medicine allografts, we can actually change things. So this is what a nerve from neuropathy looks like. It's dead. It looks like a desert. But this person got a shot of regenerative medicine allograft, and you can see at 4 weeks, these blood vessels are coming back. And at 24 weeks, this is a normal looking nerve. And not only does it look normal, it actually works again. That's what's exciting. So this actually can reverse the damage from the neuropathy and make the nerves work again, just like it did with Mr. Murray back there. And there's all kinds of studies around the world showing this. This is one from China, and what they found is they took a bunch of diabetic neuropathy patients and gave them the treatment, and it actually reversed the damage from neuropathy, and they recommended it as a treatment. But unfortunately, a lot of doctors don't know anything about it. Neurologists, the first thing they want to do is give you a pill, because unfortunately in our healthcare system, that's all doctors know about are pills and surgery. So tell us your name and how you heard about our office.
My name is Richard Mason, and I learned about your office and you from the big ad in the newspaper. And that caught my eye because of the neuropathy that I was experiencing and the pain associated with it.
Yeah. Tell us about that. How long have you had neuropathy, and what kind of problems were you having?
I had it several years. It's one of the more unfortunate things I inherited from my father, I think. He had a very bad case of it. By the time he passed, both his feet were just numb stumps. And I felt I was headed in that direction, and I was taking an over-the-counter product for it, and it helped for a couple of years, but then all of a sudden it didn't do anything, and pain was becoming more drastic, actually, to the point where walking was a problem. And I had felt like round circles of pain right between the balls of my feet. And it was just becoming excruciating, where I was having a problem walking. And I used to be a jogger, and I couldn't even do that. So when I saw the ad, I said, I gotta check this out. And after hearing your presentation and then a consultation with you, I thought, I'm gonna give this a try. I've gotta find some resolution to this, because this is not going in the right direction.
So on a pain scale of 1 to 10, where 10 is the worst pain you had and 0 was no pain, what was your pain like before you came to see us?
11.
That bad. It was terrible.
It was,
Okay.
I couldn't really stand in one spot for more than maybe a minute or so. I had to keep shifting because of it.
Yeah. There's some things you couldn't do before you're able to do now again?
Jog for one thing, and walk without pain for another.
Where were those balls on your feet? Can you show me like?
It was right in the middle, right below my toes.
So on that foot and then on your other
Both
foot
feet,
also?
and
Okay.
the left being the most prominent.
Yeah. And so any step you took and walking now would hurt, just like
Yes.
11 out of 10
I was
pain.
always cognizant of my feet,
Yeah,
you know, and the pain therein.
sure, sure. So you came to see us, you had some treatment. When did you start noticing an improvement, and how do you feel now?
Well, by the grace of God or whatever, in 3 days, those hot spots that I referred to them as were gone.
Wow.
The pain was gone. And then the numbness and the tingling started to continue to dissipate, which it's still doing. And we're right at 6 months since the treatment.
Wow. So you went from an 11 out of 10 pain to a 0. Wow.
Well, I'm not at 0. Well, pain, I'd say from time to time about a 3.
Okay.
But it's progressive.
Oh yeah, that's a huge improvement.
Yeah,
And the numbness, it's much better too.
much better.
Wow,
Much
fantastic.
better. Continuing to dissipate.
Yeah. Would you recommend this treatment to any friends, or would you do it again?
Well, yes, and I haven't provided this information to a number of friends. And so he was like an 11 out of 10 with his neuropathy. He was miserable, and he would have to shift his feet all the time, even when I first saw him, because it was hurting so much to stand on one foot for too long. And he used to jog, he had to give that up, and it was getting worse and worse. We treated him, and then within a few months, his pain was much better, and by a year, he's pain-free now. Doing wonderful, and he's jogging again, doing everything he used to do. So for those of y'all that are taking medicines, getting tests, x-rays, doctor visits, how much does that cost every year? Is it hundreds of dollars? Yeah. Yeah. Most people, it's actually thousands of dollars. And some of the pills alone can cost thousands of dollars. It's crazy. I'm going to answer some common questions. We're going to wrap things up here. Is this treatment covered by insurance? That's always the number one question I hear. And unfortunately, not a single insurance company pays for these treatments right now, no matter how wonderful they are. And people say, well, why not? This is such a great treatment. Well, unfortunately, there's a lot of politics in our healthcare system. And you can see that when you go to your regular doctor's office. You might be sitting in the lobby waiting to see your doctor, and you'll see people walk in wearing suits and dresses, and they bring coffee and donuts for the doctor and the nurses. Who are those people?
Pharmaceutical reps.
Yeah, pharmaceutical reps are the people that make the knee replacements and the hip replacements, the screws that go in your back and neck. Those companies are worth billions of dollars with a B. And they pay these people a lot of money to go see doctors every day and sell their drugs. They're just salesmen. And unfortunately, that's all doctors see. When I used to work in the hospital, 4 or 5 of these people would come see me every day, try to see me, and it would drive me crazy because half of their medicines I thought were poisons. They're not good for people. And guess who the #1 lobbyist is in Washington, D.C.? Pharmaceutical reps, same people. More than oil companies, more than anybody else. And the reason they know they're a little scared because they want a lot of control and a lot of power in what's going on in Washington. And we're one of the few countries in the world where you can actually watch TV commercials about drugs, because there's really a conflict of interest there. But they passed these laws a few years ago, and I like watching the evening news, and I'll see 3 or 4 of these commercials every night now. And they say they don't sound too bad when they start off. They say, this will help your cholesterol, this will help your blood pressure, this will help your diabetes. But then what do they talk about? Yeah, may cause death. Yeah, they have all these side effects, and so that's one of them. It's crazy. Who would take a pill that could kill you? But that's what they want us to do. And they want you to go every month and get your pills, and they don't ever cure anything. They might just keep you sick and keep getting pills. So that's the problem with that whole drug industry. And unfortunately, there's other problems. There's, a lot of my good friends are surgeons, and that's how they make money, cutting on people all day long, whether that's right or wrong. And hospitals too, they make money off these big operating rooms and keeping people in hospital. That's how they make their money. So this whole climate, it needs to change. And if you watch enough TV, then you start seeing the lawyer commercials. Did you take this drug? Did you get this hip replacement done with this implant? Call this so-and-so lawyer because there's a problem with it. And fortunately, with what I do, there's none of that. This is the most natural, healthy, like I said, the most powerful treatment I've ever seen as a doctor and the safest at the same time. So and there's a lot of politics. Even some of these insurance companies are partly owned by these drug companies. It's just terrible. But hopefully in 5 to 10 years, things will change. But if you're hurting, that doesn't help you. You know, obviously we don't want to wait 5 years to get treated. But we can help you now. Are the shots painful? Not at all, much less than a steroid shot. The healing time, people start feeling better sometimes weeks or within a month because it helps with inflammation. That's the first thing they do. And then they start healing and regenerating tissue over several months. So that's how amazing the treatment is. You're never too old to get treated. I've treated people over 100 years old and they feel 30 or 40 years younger after treatment. It's incredible. We don't treat pregnant women and we don't treat little children right now. The cost, like I mentioned, the average in my office is anywhere from $5,000 to $10,000, depending how sick you are, how many shots we need to do. And there is financing available. We work with several companies, one called Care Credit, Green Sky, and we do some in-house financing too now to help people as well. But besides these allografts, we have other state-of-the-art treatment. If you can't afford them, there's other things we can do to help with your pain, and we'll talk about that here. What's special about my office? Well, I've got over 20 years of experience in anti-aging and in regenerative medicine. I did research in a lab on growth factors, cytokines, healing when I was in school, and ever since then I've always been involved and fascinated by this field, and it's amazing how things have progressed. We treat people safely and ethically. That's our priority, and you don't see that, unfortunately, enough in our doctors' society. And we do a lot of nutrition counseling, supplement, and lifestyle counseling. You'd be amazed how big a difference this can make in your life and make you healthier. There's a lot of good research now that tells us what type of foods are safe and not safe, what kind of diet you should be on, what kind of lifestyle you should be living, and we educate you on all that when you come see us because we want you to live as long and as healthy as possible. We have many free treatments. We'll talk about those in a second. And we do a lot of extensive follow-up and treatment. All that's free. And anytime I go to a conference or a meeting, if I find something that's going to help my patients, I bring that home and I make sure you're one of the first people in the world to get it because I want y'all to be as healthy as possible. And we really care about everybody who comes to see us. We treat people like family. Unfortunately, a lot of doctors don't do that anymore. That's more about numbers than people. But we really care about people who come to see us. And that's one thing I can promise you. We'll do everything we can to help you. And this is one of the treatments that we offer in our office. We actually have another hyperbaric chamber coming this next week. But what this does is it actually helps heal your whole body. You can get in this chamber and it's full of pure oxygen under pressure. And what that's been shown to do is it actually helps boost your immune system, boost your healing power, and it's incredible. Some other treatments we have this new shock pulse therapy that helps with healing joints and tissue, helps increase the blood flow to those areas and cause new blood flow. The same with this light therapy that we use. And we have this electromagnetic field pulse device that helps us. All of this is 100% scientific, pure treatments that have been lots of research proving that this stuff works. And it's amazing. Doctors don't know anything about it, but this stuff really, really works. And we use different ones for different folks depending on what your problems are. And this is a new device we got. We're one of the first in the US to use it. We're the only one in the Southeast. It's called a light pod. And what it does is uses different wavelengths of light to heal you and to cause other tissue regeneration. And our goal is not to be just the best clinic in Georgia, but around the world. And we have people that come from other states, even other countries, to see us from South America, Europe, you name it. So wouldn't it be great if our treatments helped you or a loved one? Even half as good as Mr. Murray over there. It's incredible what we see every day. And one thing, the number one complaint we ever hear is, I wish I would have known about you sooner. I wish I would have done this sooner. And don't be like me. I waited a whole year before I finally got treated with these allografts, and it changed my life 4 years ago now. And I don't want, that's why I make my schedule available to folks. So if you're hurting, don't wait, come see us. I will promise you we'll try to see you as soon as possible, and we'll do everything in our power to get you feeling better as soon as possible as well.
Do you personally work out of Valdosta and?
I do. Yeah, I work in both offices, and then my staff helps me, the two ladies. Yeah, but I love what I do. You know, I was put on this earth to help heal people and make people better, and I love what I do. And I wish more people felt like I do.
So your cost is based on how many shots people get
Exactly.
for their treatment?
Yeah, yeah. So if somebody has arthritis all over their body and they're going to need multiple shots, they're going to be more expensive than somebody who just has a bad knee or a bad hip. So, and that's where we sit, in the consultation, we can sit down and figure all that out and then figure out what's best for you. Again, these consultations are free and we try to get you in the next few weeks just because our schedule does stay so full. Thank you all for coming. I hope you enjoyed the talk today. There's a lot more information on our website and in that material we handed out.